And I'd like to welcome you today to our MDFA webinar on NDIS and My Aged Care, Navigating Your Way Through. As I mentioned, we have two presenters today, Priya and Dalini, and the first is Priya. So Priya Narayan is a highly experienced clinical orthoptist, having worked at several tertiary referral hospitals, private ophthalmology clinics, and low vision services. More recently, she has worked as an educator at the University of Technology, Sydney, and is currently working as a healthcare practitioner program manager at MDFA. Welcome, Priya.
Thank you so much, Niv. So good afternoon. As Niv mentioned, my name is Priya, and I'll be presenting the first part of this webinar on NDIS, Navigating Your Way Through. This is the program for today. So first of all, we'll be talking about some important terms that are useful to know when navigating through the NDIS system. We'll talk about what the NDIS is, who's eligible, and what is the eligibility criteria. We'll talk about how you can access the NDIS, what supports are available, and where to get some more information. So we're going to take a journey through the NDIS process without any hitches today, but as we all know, there are always hiccups in life. So I'll give you some suggestions on where to get some extra help or assistance if you are struggling to navigate through the NDIS process. So these are some terms we'll come across frequently in this presentation. I'll explain their meaning in the next two slides, but I'll go through what they are at the moment. So first of all, NDIA stands for National Disability Insurance Agency. The NDIS stands for the National Disability Insurance Scheme. LAC is a local area coordinator and an NDIA planner as well. Don't feel as though you need to remember any of this. I'll refresh your memory as we go through the presentation. So we'll start off by talking about the NDIA and the NDIS. The National Disability Insurance Agency, or NDIA, is the agency that implements the NDIS. It determines who is eligible and how much funding an individual gets. The NDIS, or the National Disability Insurance Scheme, is a scheme. This scheme provides funding to individuals with a disability. The NDIS aims to support an individual with a disability to improve their skills and gain or remain independent. Independence in this sense doesn't necessarily mean that the person will be able to perform all tasks by themselves, but the funding allows an individual to be supported in performing tasks and activities that they would like to engage in. The NDIS is progressively being rolled out through all states and territories of Australia. So we're on to a local area coordinator, or an LAC. Local area coordinators come from organisations in your local community. They work with the NDIA to deliver the NDIS. Local area coordinators are your first port of call if you would like some more information about the NDIS, the eligibility criteria, the application process, and also what services can be funded through the NDIS. So what's in, what's out. Local area coordinators can be found through the NDIS website or calling the NDIS phone number, both of which I'll give to you at the end of the presentation. The NDIA planner becomes part of the journey a little bit later, and they become part of the journey when there are no local area coordinators available in your area. But I'll go through that in a little bit more detail towards the end of the presentation. So first of all, who is eligible for the NDIS? The NDIA uses a range of questions to determine if someone may be eligible to receive funding through the NDIS. The first two questions are prerequisites. So first of all, the age of a person and the place of their residence. In terms of age, a person must be between the age of 7 and 65 years when they first apply for the NDIS. Place of residence, people must live in Australia. They must be an Australian citizen or be a permanent visa holder. And there are other subcategories within the visa holder category as well. If you do meet the first two criteria, then you will need to fall into one of the next three categories. First is support. And support means an individual usually needs support from another person because of their disability. So for example, if you need support to perform some activities of daily living, such as meal preparation or some types of self-care. Equipment, that means whether a person uses special equipment because of their disability, for example, a motorised wheelchair. And finally, we've got support now to reduce future needs. So this could be, for example, early intervention and therapy for young children, or learning how to use a mobility aid now so you can independently access the community in the future. If you do meet the previously mentioned criteria, the next step is to make an access request. This is an application to be registered with the NDIS. The NDIA will determine who is eligible based on the information provided by applicants within the access request form. The access request form can be filled out verbally by calling the NDIS directly. A form can be mailed to you via post, and you can also download the form from the NDIS website. Some information that the access request form asks for is a person's age and residency, and that's to confirm the eligibility for the NDIS. And then there will be a range of specific questions and detailing around a person's primary disability. Primary disability is a disability that has the greatest impact on your day-to-day life. Impact can be mobility issues, difficulties with social interactions and learning, self-care. So the form requires you to provide a description as well as supporting evidence of your primary disability and its impact on your day-to-day life. Supporting evidence can come in many different forms. They can be copies of reports, letters or assessments from healthcare professionals or education providers, depending on what's relevant. And your healthcare professional can also fill out a certain section of the form. But no matter how you're applying, whether it's verbally or you're completing the form on your own with maybe some assistance with a family member, or if a healthcare professional is helping you fill out the form, the information and the evidence of your disability, that will all still need to be provided. So what does supporting evidence mean? We'll drill down a little bit further. The NDIA states that supporting information needs to be recent. It needs to be completed by a treating health professional who is directly relevant to your primary disability, and you must have been under their care for at least 6 months. The supporting evidence must confirm your disability and also confirms those aspects of your life that this disability is affecting. The NDIS does provide a guide of the type of evidence and the most suitable health profession to each specific disability. So for example, if your disability was vision, they would say that an ophthalmologist would be the best health profession to provide supporting evidence. And they will also give you a list of suitable supporting evidence to provide. And I must mention here, to have access to the NDIS, a person must be diagnosed as being legally blind. So legally blind can be when your better eye is only seeing 660 vision, and what that is that you can only see the biggest line on the vision or the letter chart, or that your side vision is so constricted that you only have about 20 degrees of side vision remaining when both your eyes are open. In terms of healthcare professionals that can provide evidence, they can be doctors like GPs or ophthalmologists. They can be allied health professionals like occupational therapists and physiotherapists. Your local area coordinator would be a fantastic resource to find out exactly the type of supporting evidence that you would need about your disability, and the most suitable healthcare practitioner as well. So now, if you're eligible, what's next? The NDIA uses an access decision letter. This is sent to your home to advise you if you are eligible for the NDIS. The NDIA will also contact you to organise a planning meeting. This meeting can occur in person, or it can also occur over the phone, and these days probably through video conferencing as well. The meeting occurs between yourself and perhaps a support person, as well as a local area coordinator or an NDIA planner. Planning meetings generally mean discussions around your personal goals and how the NDIS can help fund and support these goals. Now, before we go on to the planning meeting in more detail, I just wanted to touch on what happens if you're not eligible for the NDIS. If you're not eligible, the local area coordinator will support you in finding appropriate community services that can help support you and your goals. So even if you filled out the form by yourself without the assistance of a local area coordinator, you will still be provided with information and guidance on local area coordinators in your community that you can link up with and get some assistance from. So let's go on to the planning meeting. Before the meeting occurs, you'll be sent a little booklet to guide you on the process of the meeting, as well as what supporting documents you may need for the planning meeting. Some things that you may need to start thinking about before the meeting is what your current supports are and what services you are using. These can be informal, like family members, or external, or formal, like external care providers. You need to start thinking about what goals you may have. So for example, it could be that you would like to attend medical appointments independently, or that you'd like to read independently. And also what future supports and services you may need. So thinking about ways you can achieve your goal by using the funds and services provided through the NDIS. So for example, if your goal was to read independently, you may like to have an assessment from a low vision service who could advise you of appropriate equipment such as electronic magnifiers. You can have several goals and they can be short, medium or long term. So all of this information will help you, with the help of your NDIA planner or local area coordinator, develop a personalised NDIS plan. Everybody's plan is different, as the plan is centred around the individual and their unique goals. And I really wanted to stress here that the NDIA planner and the local area coordinator will also support and guide you in developing these goals, as well as determining which services and supports will aid you in achieving these goals. And they are an integral part of putting together this NDIS plan, so you won't have to go it alone. So what types of supports are funded through the NDIS? How long have you got? They've got a lot. I'm not going to go through them all, of course. There is a large range, and so they can range from therapy, home modifications, transport and equipment. But in general, they relate directly to a person's disability and their support needs, and that these are not currently being met by other government services. So when your plan is completed, your local area coordinator or your NDIA planner will send the plan to NDIA. NDIA will approve it and they will send you a copy, as well as the local area coordinator or the NDIA planner a copy as well. If you are not approved because further information is required, the local area coordinator or the NDIA planner will support you in making the necessary amendments or additions to the plan. The NDIS plan has 3 categories for services and supports, and each will have funding attached to it. You may get funding for one or all 3 categories. The categories your funding falls within is directly determined by the NDIS plan that you created. So I'll go through those categories in a moment now. So we've got core supports. So this is for assistance with social or community access, such as transport. Then you've got capacity building. This is to see health professionals for therapy or for assessments. And then you've got capital supports. And this is to assist you to purchase assistive technology as well as equipment. You, as the plan holder, can decide which services and which healthcare professional you would like to see and use the funding on, as long as they are registered with NDIS as a provider. The local area coordinator and the NDIA planner can help you locate services that are appropriate to you. So we are coming to the end of our NDIS journey. So I thought I'd do a really quick whip around and summarize the journey so far. So first of all, what we did, we wanted to check whether we were eligible. So we made sure that our age and our place of residence were correct. And then we needed to make sure that we fall into one of 3 categories. So one is that because of a disability, we needed the support of another person. Or 2, because of our disability, we were using special equipment. And 3, whether because of our disability, we needed some support now so that we could be a little bit more independent in the future. So once we were eligible, we decided to apply, and we applied to the access request form. This required us to prove our eligibility, plus also give some more information around our disability and the impact it was making on our day-to-day life. We received an access decision letter that said, yes, we are eligible. And then we got some information about a planning meeting. So the planning meeting occurred, and this was our chance to talk about what our actual goals were and how we can achieve those goals using funding from the NDIS. And then we received our NDIS plan. So the plan had funding attached to certain categories directly linked to our goals. And these were the important terms that we talked about as well. So we talked about the NDIA, or the National Disability Insurance Agency. We talked about the NDIS, which is the National Disability Insurance Scheme. We talked about a local area coordinator, or an LAC, and also the NDIA planner. So where can you go to get some more information? So you can visit the NDIS website, which is www.ndis.gov.au, or you can call them directly on 1800 800 110. So that does bring me to the end of my presentation, and I thank you very much for your time and your attention. And it gives me great pleasure to introduce my co-presenter, Delaney Manthalaka. Delaney graduated with her Bachelor in Science, majoring in Vision Science in 2015 from the University of New South Wales. She then graduated with a Master of Public Health from the University of Sydney in 2017. She has been working with the Macular Disease Foundation for over 18 months as an education officer, providing all the non-clinical support that a patient, family member or carer might require. Delaney also has previous experience working with volunteers at the Cancer Council New South Wales, offering training and support.
Thanks so much, Priya. Hi, everybody. As Priya said, my name is Delaney, and for this part of the presentation, we're going to be going through my aged care. Now, before I go into that, I would like to just talk quickly about today's program. So we're going to be looking at what exactly my aged care is, who is eligible to apply, what it comprises of, and what services you can receive before we look at how you can receive these services. So let's move on to the first one. What exactly is my aged care? Well, my aged care is the main point of entry to the Commonwealth Government's aged care system. And the aged care system is designed to keep Australians in their own homes, living independently for as long as possible. And they do this by providing services and programs which support older people in their daily living needs. Now, my aged care, like I said, is the main point of entry to the aged care system, and it's made up of a telephone contact centre and a website as well. Now, towards the end of the presentation, I'll actually take you through the website and how you can find some more information. So, who is eligible for my aged care? Well, it can be accessed by Australian citizens and permanent residents who are 65 years or older, or who are 50 years or older, but are low income or are homeless or are at risk of being homeless. If you are an Aboriginal or Torres Strait Islander person, these ages are 50 and 45 respectively. And it doesn't matter whether you're a pensioner or a non-pensioner, there aren't any financial eligibility restrictions for my aged care. Now, if you are a little bit unsure about your eligibility status, you again can go on their website and check. I'll show you this at the end again. Okay, so what exactly does my aged care comprise of? Well, there are three major sections. The first one is the Commonwealth Home Support Program. The second one is the home care packages program. And then the third one is your residential aged care. Now, today, we're going to be talking mostly about the first two, so the Commonwealth Home Support Program and the Home Care Packages Program, because we want to make sure that people can stay in their homes for as long as possible. So let's start with this first one, the Commonwealth Home Support Program. It's also known as CHSP. So the CHSP is designed to provide relatively low intensity or small amounts of support services in quite a timely fashion. It's generally for older people who are having difficulty with their daily living or daily activities due to functional limitations. So this includes people who have low vision due to a macular disease as well. Now, CHSP services can be provided on a short-term basis, an ongoing basis, or even an episodic basis. It just really depends on what services you require. Now, they really do put quite a bit of emphasis on independence and social connectedness, and they really do look at your individual goals and what you have preferences for and what choices you would like to make. So for example, if you don't want to receive pre-cooked meals, then you do not need to receive that service. Or say that you need to go to your monthly progress group meetings, but you're not able to drive anymore. So one of the services you can receive is transport, and you can use this service to get to those meetings, and that will also increase your social connectedness as well. Now, if you move on to fees, one of the most common questions is, how much is this going to cost me? Unfortunately, I won't be able to give you a specific number because there are a few factors that are involved. So one of the factors would be which services you decide to go for, and then it would also depend on which service provider that you choose. Now, as a client, you only need to pay for the services that you require. And what happens is the Commonwealth Government, the Commonwealth Department of Health, they actually provide funding for these providers, and therefore you will receive these services at a subsidised rate. Now, these fees aren't means tested, which means that regardless of your financial status, the fees will be generally the same. Now, for those of you who are unable to pay these fees, unfortunately, there isn't a formal mechanism or a program to support you with this. However, you can negotiate with your Commonwealth Home Support Program provider and see if you can have these fees reduced. So moving on, how exactly can you access a CHSP? Well, the first thing that you need to do is call My Aged Care. And when you call them, they're going to do a telephone screening process. And here they might recommend you to apply for the CHSP. Now, once that happens, My Aged Care will assign you a regional assessment service, or RAS. And this RAS assessor is going to call you and organise a face-to-face home assessment. So this means they're actually going to come into your own home and do that assessment face-to-face. If you would like to have somebody present during the assessment, so maybe a family member or a trusted friend or a neighbour, you're more than welcome to do that. They actually do recommend you to have somebody there. Now, during this assessment, you will be asked a number of questions about your health and your daily needs. I'd really like to stress here that it's very, very important that you are honest, open, and frankly, a little bit blunt about all the challenges and difficulties that you may be having when it comes to your daily activities. It means that, if you're very open, you're going to be getting enough of those services. You're going to be getting the appropriate level of care. You also want to make sure that if you do have any difficulties with low vision, that they know about that as well. Now, based off this assessment, the RAS assessor is going to recommend some services for you. And this will be all with the hope of achieving your goals under your My Aged Care support plan. If you find that the services they recommend are just not what you're looking for, that's fine. You can let them know as soon as you can, and you can have a conversation and change those services around. Now, as time does go on, situations can change and circumstances can change. So if this is the case, you can always call My Aged Care again and ask for a reassessment. If a patient is hospitalised, a reassessment will be triggered automatically. Now, let's look at CHSP and low vision specifically. So if you do have low vision, you can ask your RAS assessor for a referral to some low vision providers or low vision organisations. Now, these low vision organisations are done by state, so they differ according to which state you're in. I do have a couple of examples here. So there's Guide Dogs New South Wales ACT, Vision Australia, and then we have the Royal Society for the Blind as well. So that's just a range over a few states. And when you do go to these organisations, there's a number of things that you can receive, information, training and counselling just being some of the wide variety of services. Unfortunately, under the CHSP, there aren't any subsidies available for the purchase of low vision aids and technology. Okay, so moving on. So that was all about the Commonwealth Home Support Program, or CHSP. Now let's look at the Home Care Packages Program. So if you're finding that your condition has deteriorated, or you require higher needs, or you need more services than CHSP provides, you will be eligible for the Home Care Packages Program. A younger person who has dementia or a disability and they're unable to get specialist services, they can actually apply for the Home Care Packages Program too. So it is quite similar to CHSP. It's designed to keep clients in their own homes living independently for as long as possible. And a home care package is a coordinated package of care, and you can work with your home care provider to try and figure out which services are going to work best for you. Now, there are 4 levels to the Home Care Packages program, and the higher the level, the bigger the budget and the higher number of services that you can receive. So we have level 1, which is your basic care needs. You have level 2, which is your low level care needs. Level 3, intermediate care needs, and of course, level 4 for your high care needs. Now, remember how I was talking about for the CHSP, there's a fee for service arrangement where you only pay for the services that you use and require. Well, the Home Care Packages program is a little bit different to that. What happens here is the Commonwealth government will actually provide funding for the individual depending on which level that you will receive, and then you will make a co-payment to that funding. And then that little package, the funds in that package can be used for any of the services that you require. That little co-payment that you make, that will actually be means tested. So it will depend on your financial status. If you are unable to make that co-payment, there is a financial hardship available where the Commonwealth government will either waive all or some of those fees. So how do we access this Home Care Packages program? Well, it is actually quite similar to CHSP. So that first step again is to call My Aged Care. And when you do, they're going to do that telephone screening process again, and they might recommend you for the Home Care Packages program. After that, My Aged Care will assign you an aged care assessment team or ACAT. And that ACAT assessor will again give you a call and try and arrange a date and a time to have that face-to-face home assessment. again, I would like to stress, if you are going through this, please make sure that they're very aware of every single challenge and difficulty that you're having in terms of daily activities to make sure that you do receive the appropriate level of care. And then next, once you have been approved to receive a package, then you'll be put on a waiting list, and then you will be contacted once your package becomes available. If you have been assessed to receive a level 3 or 4 package, you might actually receive a level 1 or 2 in the interim, just while you're waiting for your package to become available. And of course, if circumstances do change, then you always can give them a call and arrange for a reassessment. Now let's look at the home care packages program and low vision. So again, if you do need help for low vision, then you can ask your ACAT assessor for a referral to some low vision organisations or providers. Again, they are by state. I have a couple more examples here. So we have Visibility and Queensland Blind Association. Now, the really great thing about the home care packages program is you can use that funding of money, or those funds, sorry, to purchase a low vision aid. So that can be very, very useful for somebody who has had vision changes due to a macular disease. Okay, now moving on. I know I've been talking a lot about these services that you can receive, but what exactly are these services? Well, there's a very, very big range out there. And broadly speaking, it's split into 3 separate categories. So the first category are things which keep you independent and well. So that could be things such as meals. So this could be pre-made, or maybe just help with food preparation. It could be personal care, so help with showering, self-care, hygiene, even grooming. It also includes nursing and allied health services. So if you need a physio or an occupational therapist to come in, you can actually have that as one of your services. And there's also specialized care as well, so for things like low vision. The second category is services to keep you safe at home. So this could be things like domestic assistance, so basic chores around the house like vacuuming. It could be home maintenance, so to keep your garden and home safe, or it could even be equipment, things like a shower chair or a walker to help you get around safely. And then the third category are services to keep you connected with your community. So this could be transport to help you attend social groups, or maybe eye appointments, or even just to take you grocery shopping. That can definitely be a service that you can receive. Or it could even be social support, so to encourage contact and company with others. Now, as I mentioned before, My Aged Care consists of a telephone support line and a website. So the number that you see on your screen, that is 1-800 200 422. If you would like to receive services, you do need to give this number a call. My Aged Care doesn't actually have any physical offices, and you cannot apply online. So you need to give them a call if you would like to apply. They're available Monday to Friday, 8 a.m. to 8 p.m. On Saturdays, they're available 10 a.m. to 2 p.m. They are closed on Sundays and public holidays. And like I said before, they do also have a website available. So that is www.myagedcare.gov.au. And I'd just like to take this opportunity right now just to show you how easy it is to access the website and the amount of information they have available there. So let me just go here. So all you need to do is go onto Google, and if you just type in My Aged Care, it should come up. It will be one of the first results that come up. So you can go ahead, click on that, and then this will take you through the different steps of applying for My Aged Care. So you can learn about the different types of care, the assessments that are involved, and how you can find a provider and how you can manage your services. So this is, first of all, on their homepage. You don't need to look any further. If you would like specific information, you can actually find that on their website as well. So if you want more information about the Commonwealth Home Support Program, that is here. So it takes you through eligibility requirements, and it also takes you through those services that I was speaking about as well. And I know I spoke about the fees that are associated with the CHSP. This will tell you a little bit more information, and it goes through some really great frequently asked questions as well. There is a lot of information on the home care packages as well. You can see here again, what sort of help you can receive, all the services that are available too, and then some frequently asked questions. It even talks about those different levels that we quickly went over. And of course, if you do want to check whether you're eligible, you can do that on the website too. It tells you all those eligibility requirements, and it also tells you what you can do next from there. Okay, so quite an easy website to use with a wealth of information. So if you do have some time, I really would encourage you to go through that and see sort of the services that would be available for you. So we'll just go back to the presentation. Okay, so before I finish, I would like just to talk about some things to take away from this part of the presentation. So first of all, My Aged Care is designed to keep you in your own homes for as long as possible. So please don't be afraid to apply for it. If you need any assistance, just apply. Number two, make sure that you apply early. Please don't wait for a crisis to occur before you apply. Sometimes there can be waiting periods of up to a year for you to receive services. So you want to make sure that if a crisis is to occur, you're at least receiving some services while you're waiting for the rest of the services. And if things are to change in the future, you can always just apply for a reassessment. And number three, reach out for help. You may have seen, going through NDIS and going through the My Aged Care process, it can be quite a difficult process to apply. And going through all the steps can be quite difficult as well. So in these situations, you can always ask for help. You might be able to ask, a trusted friend or a neighbor or a family member and appoint them as a spokesperson so they can help you with this application process. Or you can go contact an advocacy service such as OPAN, which is the Older Persons Advocacy Network, and they will actually help you through the process of application. Or you can always give us a call, the Macular Disease Foundation Australia, and we'll direct you to the most appropriate service. So thank you so much, everybody, for listening. I hope there was a few things that you took away from that, and I'll just give it back to Niv now. Thank you so much.
I'm muted. I've unmuted myself. If you do have any questions about anything that either Delaney or Priya spoke about, you can of course ask a question. So you can do that by pressing on the questions icon, then typing your question into the white box and then pressing send. So just before we move on to the questions, I just want to speak briefly about what we do here at MDFA. So our goal is to reduce the incidence and impact of macular diseases, and we do this through a number of pillars. The first being in prevention and early detection. We provide accurate, current and ongoing information. Just last year, we reached almost 7,000 people doing talks just as this one. We aim to raise awareness about macular diseases and encourage people to get their eyes tested regularly for early detection. Another pillar is in supports and services. We provide supports for all patients and facilitate access to other support services as well. We aim to support people living with macular diseases to continue to live well. We are very proud to be the voice of the macular disease community. It is our privilege to advocate for the very best interests of the macular community and to ensure they continue to have access to the supports and services required to live well. And lastly, research and data. 100% of funds donated to research go into our research grants program. And since 2011, we've given over $4 million to 21 different research projects. So we aim to promote research for better health outcomes, and our CSI surveys actually inform what we do and provide an evidence base for stakeholders and decision makers. So this is how we can actually help you. The number I've rattled on a lot of times, our toll-free national helpline number, 1800 111 709. You can give us a call anytime. We're open 9 to 5, Monday to Friday, for any questions you might have, not just about My Aged Care and NDIS, but if you've been recently diagnosed with AMD, or if you have any questions about diabetic eye disease or anything else, you can always give us a call and we can help you out there. If you do have someone who doesn't speak English as a first language, we can also provide translated materials as well. Speaking of, we do have a lot of resources that we're able to send out to you for free, and you can view and order all of our resources on our website, which is www.mdfoundation.com.au. So I see that we have some questions coming through, so I might bring back Priya and Delaney, and we'll go through a couple of your questions. All right, so the first question actually I'm going to answer. Someone just asked whether this webinar will be available at other times or as a permanent resource or link. And yes, you can actually, this webinar will be recorded and you can view all of our previous webinars on our website. So the email that we send out at the end of this webinar will contain a link to all of our previous webinar recordings, including this one, which will be uploaded in about 2 days. So now that I've shone the light, I will ask a question for Priya. When I turn 65, am I still eligible for the NDIS?
Absolutely. If you've registered with the NDIS and have been receiving funding through the NDIS, you can choose to remain with the NDIS or swap over and access services through My Aged Care. You have that choice.
Okay, excellent. And then a question for Delaney. Can I get funding through My Aged Care and NDIS at the same time?
Oh, no, not at the same time. So it will be, you know, either option. It will also depend on your eligibility as well, but no, not at the same time.
Great. And then another question for Priya. How long does the NDIS plan and funding last for?
That's a good question. Each plan lasts for 12 months from when it was approved. And then after the 12 months, you can go through a review process, looking at your goals and what sort of supports and services you need. And then NDIA will approve another 12 months of funding. You can also ask for a review anytime within the first 12 months of the plan. For instance, if your support needs have changed or something's happened where you need some more services and support, you can definitely go for a review.
Okay, excellent. So this is quite a long question. It's for Priya again about the NDIS. Is there any chance the age limit will be increased for NDIS eligibility? As someone who's struggled with Stargardt's disease for a long time, it can be very frustrating when you reach over that age and you're still quite active and working as well. Have you heard of anything or about an increase in that age limit?
So in terms of the age limit between 7 and 65, so you can apply at any time within that age. If you tick over 65 years of age, you can choose to continue to have funding. But I think the question is, if you've gone over the age of 65, what do you do? So unfortunately, with my research, there isn't anything that I know. I'm not really in the know about what happens with the NDIS or NDIA behind the scenes, but they are very strict in terms of their eligibility criteria with the age and place of residence, especially.
Okay. Great. And I guess if there's any more information that they wanted to find out, best to give their number a call.
Absolutely. The local area coordinators, are your best source of information. Yes.
Okay. Excellent. And this isn't really related to either, but I feel you both might have an answer to it anyway. Any recent developments in dry macular treatment in the last 2 years? I know that there's a lot of stuff going on behind the scenes, but nothing really at the moment that's ready to go.
Yeah, I think not at the moment. I think everything's sort of in the pipeline. There's a lot of research going into it. There's, research into stem cells, gene therapy. There's a lot that's going on. For the earlier stages, there was a 2RT laser done by Sierra down in Melbourne. So there's a lot of research going into it. This actually might be a great time for a plug.
Yes.
If you would like to keep up to date with the latest research, MDFA, we have a free newsletter that we release, and our summer edition every year has a very thick section in the middle all about research. So if you want to keep up to date with that, you can just sign up. It's free.
Yeah, exactly. And if you want to sign up to that, you can visit our website or you can give us a call as well, and we can help you out there. Okay, perfect. I think that is basically all the questions we have for now. Thank you so much to both Priya and Delaney for answering all those questions, even the ones that went a little bit to the side. And thank you to all of you for asking those questions as well.